Welcome to Digital Wellness Without Intensive Care, how to improve your hospital or healthcare website and increase patient engagement. We are Silvertech, digital agency. We specialize in helping our clients create valuable digital experiences for their customers. Website and mobile development, digital marketing and strategy, user experience design, Salesforce development and integration, marketing automation, application development and managed services and hosting, all united by our lead to loyal approach. Today, we're going to be going over digital trends that we've been seeing in healthcare. We're going to discuss how to own and manage physician ratings. We'll discuss further how to organize and optimize content for patients and search engines. And then we'll end with targeting patient personas. I am your host, Ian Hughes. I am the content marketing strategist here at Silvertech. I write for the Lead to Loyal podcast and blog. And I am joined by Silvertech's healthcare experts. I'm with Peter Palmer, our digital strategist. Pete has expertise in SEO, content, social media, client management, and PPC. He's passionate about working with healthcare clients like Catholic Medical Center to help them achieve business goals using the appropriate digital marketing channels. Welcome, Pete.
Thanks, Ian.
And we are also joined by Senior Account Manager and Neshco board member, Chad Campbell. Chad is a recognized speaker in the healthcare industry, having been featured at Chiprams and Neshco, where he also serves on the board of directors, as I mentioned. So first up, let's dive right into an overview of digital trends in healthcare. So, we're seeing a paradigm shift. Much like other industries such as finance, retail, and travel, healthcare is set to become patient-driven and accessible from anywhere and at any time. Under this new model, patients are empowered to closely monitor their healthcare spending and their own health, interact with the new healthcare system outside of the hospital walls, and employ the use of technology to improve their conditions. Pete, how are frameworks such as the Health Information Technology for Economic and Clinical Health Act, HITECH, and the EHR incentive program, how are they driving this shift?
They're really driving the shift down to really the purpose of all of these frameworks. The frameworks have all been created basically to open up the access to patient data and to use that data in a healthcare setting in a meaningful way. And hospitals and healthcare providers are incentivized to use this patient data in a meaningful way, and they're doing so by utilizing some of the technological innovations that have come off the back of the EHR incentive program and the HITECH Act. And so with the availability of this data and the regulations around how it can be shared, both internally within healthcare providers and externally to third-party providers, we're able to offer patients more access to their records and to take more control of their healthcare outcomes. And that can be through simple things like offering a direct messaging portal through, say, a mobile app or through a website, right down to access of medical records through a portal or an app. And just to give those patients that level of oversight around their own data and to enable healthcare providers as well to use that data to proactively reach out to patients on their healthcare issues before issues become bigger issues.
Yeah. Chad, who do you see as being set to benefit from this paradigm shift?
Well, I think Pete kind of touched on it a little bit there at the end. I think it's both clinicians, so people that are going to be helping other people stay healthy, as well as the patient. So I think when we're looking at something like diabetes care, for example, from the clinical side, from the hospital side, when you're looking at the entire population and how the data of all these people with the same disease, they can start to see where cliffs are, where people can fall off and get into worse shape than they already are, rather than get better. So I think from the clinical side, this data is going to help provide a better level of care. But I think also on the patient side, they're going to benefit because they're going to have access to things like their medical records if EHRs could get a little bit better at their usability, and actually Silvertech's working on some of those things, but giving people meaningful access to their records and information that is going to help empower them to stay healthy is another benefit. So I think it's both patient and clinician that can benefit.
It enables patients as well to use the now available medical data that has previously been kept away in these really secure systems, but is now available to them in the palm of their hands. It enables them sort of integrate and combine that data with data that they might have on other healthcare apps, which are emerging and booming at the moment, and enables them to use both of those sort of data sets together, which they can then share back to their healthcare providers to fill in any gaps that healthcare provider might have on that patient's activities and management of their own healthcare, and fill in those gaps to provide a better outcome.
Yeah, so you're seeing more empowered patients, I think, much like in other industries. Consumers are more empowered. Patient expectations and technology. Shifts like Uber, Amazon, and Airbnb, they've redefined how consumers engage with and experience brands. This has resulted in rising customer expectations for more personalized, customer-centric interactions, in addition to meaningful and lasting digital engagements that are centered around the right value proposition, the right content at the right time. Chad, is healthcare, is it exempt from this evolution in consumer behavior?
No, absolutely not. That's not what we're finding from the research we've been doing recently at all. And I don't think that's really a big secret anymore in healthcare, finally. I think there's quite a few hospitals that we're working for now where the market research for their specific demographic area is showing that that people have a certain expectation from their hospital's website and other channels. So they expect to be able to schedule an appointment. They expect to pay their bills online. They expect to be able to find the information they're looking for online. They don't want to have to call. They don't want to have to deal with paperwork. It's not the channel that they're providing. So no, they're not exempt at all. If anything, it is an area like finance, like banking and credit unions that has to be at the forefront of this type of engagement to drive revenue, to close the loop on marketing spend, internally and then externally from the patient side, providing a good patient experience.
So another thing that's kind of shifted here is, Pete touched on it, but getting control with wearable devices, smartphone apps that enable patients and consumers to collect and monitor their own health data. This presents an increasing interest in taking ownership of overall health and well-being in growing portions of the population. Pete, will all of this data, will it lead to a healthier population?
I think so, yeah, and we've spoken about it before, that I think there are two different population sets. There'll be those groups of people that take a real proactive role around their health, and they engage with their health goals every day, which, there's a definite market for it out there. There are tons of health apps, so it shows that people really are interested in their health, and it's growing daily. But then there's another population that might not take such an active role in the way they manage their health. But I think those people can be managed by the use of this now shareable, more accessible data by members of a healthcare organization internally. That data is now accessible to a number of different healthcare providers that can look at healthcare data, patterns in that healthcare data, and reach out to those populations that might not be so active in the management of healthcare, and say to them, hey, we've noticed that there are these particular trends in the way that you're currently managing your healthcare. We advise that you might take these steps to avoid any future issues. So I think overall, having access to all of this data definitely will have positive outcomes on healthcare. It's just in the way that it's managed. Some people will choose to manage it themselves, whereas healthcare providers might have to take the rein on other population groups to make sure they fulfill their health.
Yeah, I think the example we were talking about before when we were just chatting was about how I didn't necessarily think it was going to keep people healthier, because I think if you are a heavy drinker and are overweight, a healthcare app isn't necessarily going to stop you from doing that. But that being said, if you going back to the diabetes example, if you don't manage your diabetes, you can get severely ill, which then gets you into the EHR, into the ER, into the hospital, costs the hospital money most likely. If you can prevent that through technology and providing tools like monitoring of blood sugar remotely, things like that, that you then do have the ability to drive down people going to the EHR and getting sicker. But yeah, I don't know if it's necessarily going to make anybody change their habits.
Sure, yeah. Let's discuss the competitive landscape. Increased competition has forced hospitals and healthcare organizations to rely on marketing for patient dollars more than other factors in the industry. In addition to private clinics and walk-in sites that are privately owned and operated, hospitals are also diversifying their options to include service lines such as urgent care. So kind of two things at play here. As important marketing dollars are, Chad, Pete, I imagine this also means that digital marketing is more important than ever.
Yeah, I mean, we've seen it. We've been seeing it a lot. I think the industry is finally catching up to the fact of how important it is. I think a lot of hospitals are looking at the digital piece as something that they have to start really investing in. And I think a lot of that is driven by that free market. So a lot of hospitals, their problem isn't necessarily volume. It is the right kind of volume. And I think a lot of what Pete and I do when we're working with hospitals is engaging with the right type of patient. So paid provider patient, somebody that wants to maybe be, that we may be targeting for high margin procedures like oncology or orthopedics or surgical weight loss. There's a huge competitive landscape there between hospitals to get those types of patients. So if you're not on those platforms, if you're not engaging with those types of patients are going to other hospitals. So I think there's the competitive landscape is really making it important for hospitals to ramp up in that department and engage with those patients.
Yeah, and that level of competition is kind of reflected as well in industry data and research that's out there on the way patients are using digital channels to fulfill certain healthcare needs and to interact with their healthcare providers. And the trends are showing that it's largely moving online. It's less paper-based now. It's less sort of going into a doctor's office for the very first time with your first requirement. It's more the research phase has kind of moved online as well. So more people are researching their conditions before going to their doctors online.
Sure, yeah.
So it's a great opportunity for hospitals and healthcare providers in general to make sure that they're visible and exposed for these kinds of needs-based and research stages in the patient life cycle, to make sure that they're there and that they're seen, because those that are obviously going to reap the rewards, and those that aren't are going to lose out.
Yeah, I think we did some industry research that we then correlated with some work that we did concerning primary care and how people search for primary care physicians. And I think in the small geographic area that we were looking at, probably a population of 200,000 to 300,000 people, we were showing data from a client that had to do with primary care search results, people that were looking for a primary care doc, and we get like 59,000 hits, I think, Pete, and I think it was a two-month period.
A couple of months.
So I mean, and then there's more national industry data about that type of search, but if you're not there trying to fill that funnel on the primary care side, which is the feeder for the rest of the health system or the hospital, that's
Somebody
where people
else
are. They're searching for those physicians online.
There was a Google study that showed that 77% of patients were using search engines as a first kind of research phase to look for hospitals and healthcare. That's a large percentage of people, and you can't ignore that. If you're not investing in things like SEO and search engine marketing, PPC, to ensure that you have a presence on the search engines, then that translates into a lot of missed opportunities for acquiring new patients and new business. So really, really important.
It is, and we'll get it into a little later in our presentation, how to kind of optimize your SEO and SEM efforts to make sure that you are found. Let's talk about, just for a moment here, what's important for hospitals and healthcare organizations. Reputation. Obviously, a hospital's reputation is its lifeline. And to recruitment. Hospitals and healthcare organizations are only as good as the talent they attract and retain. And then on the flip side of that, what's important for patients? A hospital reputation and customer service. A high standard of customer care must be apparent throughout, or a patient may select another facility. It's also important for patients, their experience. Once a patient makes a selection, they're not necessarily inclined to want to change unless there's a pressing reason to continue the search. The other thing that's vital for patients is that access to complete tasks and information, something Chad touched on earlier. Patients expect all forms of communication, regardless of medium, to be fast, easy, and effective. So they expect to be able to book those appointments online. They expect to be able to do everything digitally. But there does seem to be alignment here. There does seem to be alignment between what's important for hospitals and what's important for patients, in that they both value reputation. But are healthcare organizations, are they focused enough on the patient experience, Chad?
I think they're trying to be.
Yeah.
I think that a lot of times the upfront efforts that come from marketing departments are generally blocked or hindered by operational people like CIOs, clinicians, things like that. I'll give an example of we worked for a hospital that I think it was the director of strategy and development wanted to really push for online appointments.
Sure, yeah.
And so we vetted a third-party provider. It ended up being a really good system. We actually liked working with the system, and then we were going to start rolling it out, first with the urgent care service line, and then with a few primary care service lines, and then move on from there, which made sense. And what we found was we were able to put it up on the site and get it moving, and it was being used. So I actually happened to get sick, and I went to the urgent care facility. I booked an appointment online because I was like, this is a great way for me to do to test this thing out, and I had to go anyways. And I made my appointment online. It was for 11 o'clock. I got my confirmation. I get to the actual facility, and there was no continuum there. The place was packed. I still had to wait in line. Timeline went past of when my appointment was supposed to be. I still hadn't talked to somebody. It was extremely frustrating. So when I spoke to some of the people in senior leadership about this and about the operation, I was like, I can take my kids to a haircut. Get a haircut at Fantastic Sam's or Supercuts or whatever the local place is, and we can make an appointment online, and then when we get there, everything is up on a screen when you show up, where you are in queue, if you're running late, and it's an easy check-in when you get there.
Right.
So there's a continuum there, and that's really where hospitals, we found, is the marketing departments might be a little bit more at the forefront of this.
Yeah.
But then it's the shift to have that continuum of care actually be used or included from the operational side.
Yeah, so I think you're seeing that, like you said, the marketing departments are embracing digital, but what we need to happen is the entire organization needs to embrace this digital transformation and just know that it's
exactly, and it's a big shift. It's a big change, and it's a lot of hard work. But
and there's a danger that healthcare organizations just see the rise of personalized experiences and customer-driven experiences as just a retail consumer level thing, which healthcare isn't like that. The consumer model is really based around the initial identification of a customer's or a consumer's need and how they research providers that satisfy that need. And then it usually drops off from there for retail. But for healthcare, as Chad just mentioned, there's a huge opportunity to have much more of an important impact on what happens after that research stage. So in the point of care and the aftercare aspect of it, that's where I think healthcare should be focusing upon, looking at what systems they put in place to ensure that patient experience is carried over past that point of identification of a need and researching a healthcare provider. What can we do after that to ensure the experience is carried over? Because many of these things that we look at that are important for patients, like hospital reputation, their experience and the ability to complete tasks and information, a lot of these things can be presented to the patient on that first interaction on the website. You can demonstrate customer service, healthcare provider reviews, patient tools like portals and being able to book appointments. You can demonstrate all of that when a patient first visits your website. So I think healthcare providers are kind of getting to the point where they have that covered, but there's a lot of work to do with what happens after that.
After that, yeah, absolutely. So where does the patient journey begin? And we've touched on this, some of the data to back it up. 84% of patients use both online and offline sources for hospital research, and search drives nearly 3 times as many visitors to hospital sites compared to non-search visitors. 44% of patients who research hospitals on a mobile device schedule appointment, kind of back to Chad's example there. I think the key takeaway is among the most important tools for social and online marketing is an effective and intuitive website. Like you said, Pete, you can demonstrate all of these things that are important to patients right there. So your website should be considered your ultimate brand statement. What role then does your website play in managing your reputation? How critical is it then?
It's really important. I think that healthcare is something that a consumer is always going to need, regardless of the initial experience that they might have with a provider. They could have a bad experience, but they're still going to need to go and see a doctor. But it's going to be the healthcare providers that really demonstrate that optimal patient experience that are going to acquire those. So if the patient sees a website or is researching a primary healthcare provider, for example, they might get a bad experience on the website, and they might they do go away and they research other providers. And if those websites have better experiences, they're going to be more inclined to go with those healthcare providers, because that for me would say, well, this brand cares a lot more about its patient experience and what happens afterwards, so I'm going to go with them rather than this healthcare provider that has a poor experience online. I don't know what I'm going to expect down the line.
It's interesting how closely tied the website experience is to the patient experience.
Yeah, and we see that outside of healthcare. I mean, a lot of organizations we work for, like maybe an engineering firm, for example, we work for a biomedical device manufacturer, designer. I mean, they develop software, they develop very complex systems that are actually in hospitals, like ultrasound machines and things like this. They do not get business online. People don't come to their website and say, I'm looking for an engineering firm that can build me software around this. It's just not how that business works. You do a lot of research, it's word of mouth, you meet people, it's a very long sales process. But the website is a validator, if nothing else. And I think that's true at the very least at a hospital. It's a validator. Does this look modern? Does it look easy to use? Does it have some amount of functionality? It validates the brand.
It does,
at a minimum. And it can do the opposite if it's an old, non-responsive website that just has page after page after page of copy. That nobody reads.
No.
It could go both ways.
Let's go a little further then on this idea of validation and discuss how to own and manage physician ratings. Well-known example here, Cleveland Clinic. With hundreds of thousands of reviews, Cleveland Clinic's presentation is both a validator of its reputation and a clever way of owning physician ratings. Why go to Yelp to review your experience when there's an easy-to-use, well-maintained portal such as what Cleveland Clinic has? Now, I know many organizations don't have the budget or the team that's probably behind this at Cleveland Clinic, but I think there's pieces of this that you can take away and implement on your hospital website. Chad, what are your thoughts?
Yeah, I mean, for everybody that's listening, thank you for listening. The fact that we use the Cleveland Clinic as an example, it's not the first time you've heard that. I mean, everybody knows the Cleveland Clinic, and everybody's like, yeah, Cleveland Clinic, whatever.
You can get there.
But, they are at the forefront, and everybody knows that. But there are some things. There's some things we're working on right now. So because of a lot of what's driving this is transparency through some regulation called HCAHPS, and I always have to look it up. HCAHPS, Hospital Consumer Assessment of Healthcare Providers and Systems. But basically, it's regulation around transparency. The whole thought is you need to, if patients are actually rating your physicians, it is going to drive up how the patient experience and the type of care that they are receiving.
Right.
If you keep telling a doc he's not very personable, maybe that doc will become more personable and work on that. And there's other transparency pieces around it. Couple things that we're doing right now. This is relatively, although it's been around, not too many people have been really embracing it and finding ways to deal with it. Some people are creating a random page that fulfills enough of the regulation or the mandate that the hospital wants to follow.
Sure.
Others are a little bit more proactive. So many hospitals use a platform for patient experience surveys from Press Ganey. There are others, but Press Ganey is the biggest one. And what Press Ganey is doing is working with another company that is taking Press Ganey survey data and manipulating it through an algorithm that then translates that survey data into star ratings.
Sure, yeah.
It also takes out some amount of the reviews, the actual reviews, or comments, I should say. We are then working with them and that company and with one healthcare organization to take that data and present it online as part of the physician finder. So you can look up a physician, see their star rating with all the other information that's generally in a physician finder. It's relatively new. It is moving along. It's very doable. I think that there's an opportunity for healthcare providers to do that, but we're also looking at working with a couple other research organizations at creating more complex, or I should say, more precise surveys rather than the generic Press Ganey survey, to get more real actionable data that actually means something to what patients are looking for when they want to look at what type of person a physician is or what kind of provider they are. So there's a lot of different options. Again, I'll bring back the operational piece to that.
Sure, yeah.
Which is really when you're telling a physician or a physician group or a whole, all your employed physicians and maybe even beyond, hey, we're going to be putting up your ratings and reviews that patients have on you online. You have to have some sort of a system of review in place and empower the physicians so that they feel comfortable and understand what's going on. That's really the bigger problem, I think, and that we're facing with a couple of these organizations we're working with. But it's something that has to be addressed and looked at, and you have to make a decision as an organization. Are we going to be a leader here and be like the Cleveland Clinic and be a hub for people to find information about our physicians? Or are we just going to say, we're going to rely on Yelp and, health grades to provide these? So it really depends on what your organization is looking to do and accomplish, but there are ways to do it.
Yeah. Claim your reviews. I mean, if you don't want to pay hundreds, even thousands of dollars for premium subscriptions to some of the larger physician review sites, there are things that you can do on a smaller scale that can net large returns. I think it starts with claiming and populating your healthcare facilities information in your free listings and using them as online hubs to showcase patient testimonials and positive reviews. Any SEO benefit there, Pete, in getting out and claiming those free sites?
Yeah, for sure. There's a good amount of benefit for generating reviews on the site because it's fresh content.
Yes.
The search engines love fresh content, so the more you can bring into the site, into your own website for reviews, the better. It's a great opportunity for you to present those results in the search engine results, and that's going to lead to better reputation management as well.
Sure. Yeah, it's if your patients are out there reviewing, they're essentially creating content for you to use and populate on your website. So it's, I think, critical to bring it back to your own site, much as the Cleveland Clinic has done there. Let's talk a little bit about how to then enhance your listings. I'm sure healthcare marketers know this and have heard this, but the importance of video. Utilize video to introduce your physicians and let patients tell their stories. A 2 to 3 minute YouTube video embedded on your website can have dramatic impact. You're 53 times more likely to appear on Google's first page if you have video. Online video delivers 10 times the response rate than static text and graphics. And click-through rates increase by 96% when you embed video in e-newsletters. I think what opportunities beyond, I think it speaks for itself, but what opportunities, Chad, do you see video presenting healthcare marketers?
Yeah, I think I think there's a couple main things that our partners at Jennings Health do a really good job with two things: physician videos and patient story videos. They really excel at it and have gotten some great return on it, and we've seen it on their sites, on our sites that we've done with them. So a couple of things we found that when people are looking for a new physician, it's usually generally a name and a picture,
Yeah.
and where they went to school and what their specialty is. You know, that generic information. You don't really know anything about the doc, and then once you go through that process of choosing a physician, then you schedule an appointment, then you show up and you don't really like that person.
Right. Yeah.
It might be for
Personality
a
doesn't clash.
variety of reasons.
Yeah.
And a lot of times what happens when you include physician videos into a physician finder or into a section of the website where that physician might be prevalent, it humanizes that person.
Mm-hmm.
You find out why they went into medicine, what drives them. Maybe you find out some personal information about their family or why they live in the area,
Yeah.
or a variety of different things that you might be able to relate to as a patient and find some reason why you should or why you would like to choose that particular physician. And then the other side of it is patient stories. I think if you're going through a certain medical condition and you can hear other people's stories that have gone through the same thing, there's that level of empathy and that understanding that you're not alone in this, and that
Right.
this hospital, these providers have cared for people like me successfully.
Mm-hmm.
It humanizes the brand drastically. Hospitals are such big, huge, massive buildings, institutions that are generally not that nice looking and have a smell to them. And a variety of things. But this video can really humanize so much of that. So I think it's important from that brand perspective.
Sure, and I don't think we're talking about massive productions or anything. We're talking
No,
about
we're
1 to
talking
2 camera
2-3 minutes. Yep.
setups, 2 to 3 minutes that's uploaded to YouTube and
Oh
embedded
yeah,
right on the
Jennings
website.
generally. I mean, it's generally a couple guys.
Yeah.
And Dan Dunlop, and that's.
I mean,
about
I think
it. Yeah.
you have your physicians answer those questions that you would set out there.
Yeah.
I think you shared an example earlier, Chad, about a group of physicians that did
Yeah.
use video and
Yep.
those that didn't. What
Yeah,
were the results
So we
there?
worked for a small hospital about 3 or 4 years ago. Built them a website, and we included the ability to upload videos into the physician finder. And we found, I think, about 25% of the docs ended up actually doing the videos. The rest of them were like, nah, I don't want to do that. And those 25%, it was very clear. They had more engagement online. They were getting more patients from online. And like I said, it really humanized
Right.
who they were. So people were receptive to it and they liked it, even 4 years ago.
I think engagement is a big one as well. Like from a crude marketing perspective,
Yeah.
someone would, and data backs this up, someone would rather watch a video than than sift through tons of written content.
Yeah.
Providing it has value, of course. I mean, if a video presents immediate value, it's a lot easier to deliver your message in 3 minutes than for someone to sit 10 minutes and read
Right.
a bunch of copy. And the conversion rates, again, data backed, are often better from video than they are from text and copy. So,
Yeah, and there's
benefits
a lot of
to
platforms that allow you to track in detail, where people drop off.
Oh, sure, yeah.
That's
Even
great.
the basic
Yeah.
analytics on
Yeah.
YouTube will
Yeah.
tell you
Yeah. Tell
how
you a
long
lot.
somebody's viewed
Yeah.
your video, what that sort of engagement
Yeah,
is.
but I think that's a good point, Pete. Is meaningful video. I don't think nobody's going to watch the video on the new Da Vinci surgical device that the hospital just got. Nobody cares.
No one. Patients certainly don't care about that.
No, they want to know the physicians and they want to get a sense of what the experience will be.
Yeah,
And they want to hear stories similar to theirs, I think.
Exactly.
And to touch upon what you mentioned as well, Ian, going back to like the crude marketing aspect of it, a website that has video on its website is more likely to be seen in the Google search results. But going further than that, you can also make sure that your video on your webpage is also shown in the search results.
Sure, yeah.
Through the way that you tag it up. So immediately you're offering more engaging content before someone's even visited your website.
Yeah.
So good benefits there as well.
Sure, yeah. Just help you own that first page of Google search results. It's all your content.
Yep.
A few things to keep in mind in reviews and ratings. Just appreciate every bit of feedback. Positives, much welcome, pat on the back. And respond to every bit of feedback promptly. This is where monitoring is key. Take customer service issues offline as quickly as possible, and delete comments only when they're profane, derogatory, or a violation of patient privacy. Just to touch on social media real quick. Overall, only 5% of social media mentions across all organization types are negative. The rest are neutral or positive. Pete, so why do so many healthcare organizations shy away from fully embracing social media?
I think because it's like a really personal thing. Your healthcare is very personal. It's potentially sensitive information. And patient experiences can often be attributed back to an individual as well. With consumer brands, a bad review is often going to the company, not necessarily a person. With healthcare, any bad experience can be pointed towards a particular individual in a healthcare organization. So I think that's why they shy away.
Yeah, it's understandable. Yeah.
But it's a great opportunity again to manage reputation and manage reviews.
Yeah.
If someone's had a bad experience, they do go to the likes of Facebook to present those grievances. So it's a great opportunity for healthcare providers to address them in front of a public forum.
Yeah, the negative
And
gives
say,
you the
okay,
opportunity.
Yeah,
Yeah.
and say you've had a bad experience, but hey, this is what we're going to do to resolve it. And that's great from a trust point of view. The consumers will trust brands more that demonstrate, that they're transparent and they're actively trying to produce meaningful patient experiences and not trying to shy away from those bad experiences.
Yeah, I think we've found a lot too is that I find time and time again as we work with more and more hospitals is it really a lot of times also comes down to bandwidth.
Sure.
They just don't have the people to do it, so somebody loads up Hootsuite or something like that, and they kind of let it ride, and it covers them for the week or for the month.
Sure.
And it's kind of a crockpot social media plan because they just don't have the bandwidth. It takes a lot of energy to do it well. It does too. Which surprises me because then every hospital has every social media channel possible.
Yeah.
Rather than just doing one
Just
really
doing
well.
a few. Yeah, yeah.
And I don't think people often don't see the value either or the need for it. But there's research out there that shows that a large number of people use social media to discuss their healthcare needs, some of their conditions, and they also use the information they find on social media to make choices around what healthcare provider they use. So it's a great channel for healthcare providers to take the reins and take the power away from the consumer a little bit in terms of like the reputation aspect and manage it more themselves.
Let's dive into how to organize and optimize content for patients and search engines. Here we're going to quickly go through some kind of quick and easy steps you can take to organize and optimize your content. We'll go quickly through this. I do want to touch on personas before we run out of time here. So let's dive in here. How to organize content. You want to make sure on your website you're using headings and subheadings to your advantage. It's helpful for scannability, also has SEO benefits. As we were talking about in the video example there, we were talking about, nobody wants to just go to a page that is just massive amounts of text, but you can break that up and you can make it so that, the patient, the reader can scan. So you want to make appropriate words bold. You want to use hyperlinks to the right keywords, use bulleted lists, short to the point paragraphs, and convey complex information with infographics or images. So this is just how to organize content on your pages. I think I'd like to share some tips now on how to kind of then optimize your content for search purposes. Tip 1 is to write quality titles and meta descriptions. While Google hasn't used meta descriptions as a ranking factor in a number of years, it still helps to write compelling content that accurately displays what your page is about to help achieve higher click-through rates. Pete, when you're doing SEO audits, I think this is not just healthcare, but is this something people are focusing on, and how important is it? How much should they be focusing on this?
To begin with, I don't think people pay enough credence to it. Like I often see websites that don't have custom titles or descriptions in their meta information.
Yeah.
And that's kind of like the first thing that people see when they search for healthcare providers online. They see the title and the description. So it's a great opportunity to really tailor a message and to bring people into your website rather than rely on some randomly generated script.
Sure, because that's what the search engine will do.
That's what they'll do if you don't do the work yourself, and it can lead to lost results.
Sure, yeah. So you want to, when you're writing your browser titles, explain what the page is, keep it between 50 and 60 characters, and then for your descriptions down below, you want to include relevant keywords, but keep that to about 150, 160 characters. Tip 2, improve your page load speed. The speed at which your website loads is playing a role in how you're being ranked. And there are tools out there. We'll be sharing several resources after this presentation. One of them here is a Google tool that you can use it's worthwhile dropping your pages in there and see how fast they're loading. Back to that website experience relating to the patient experience. if that page is taking too long to load, I mean, are they
Yeah.
going to stick around? I mean,
No, I mean, best practice is to ensure that your site or pages on your site load in under 3 seconds. Anything more than that is not good, and furthermore, it doesn't translate to mobile experiences. It's even worse on a mobile
Yeah,
device.
I'm sure that time is a lot lower on a mobile device. Again, we'll share out some of these resources after the presentation, but worth kind of dropping your site into these Google tests here. Third piece here is to provide useful and relevant content. I mean, Google's paying attention to the phrases. And I had originally written this up as just the words, but Pete, you're saying now it's more those long tail phrases that the search engines are getting smarter. I mean,
yeah, tons smarter. I mean, Google's always updating its algorithm. It's getting more and more into artificial intelligence. So it's getting more of an understanding around the intent of user searches. So no longer does it rely on single words. It's more about the context in which that word is placed in a larger phrase. So that plays an equal level of importance when you're producing content for a website. Don't just think about keywords, think about context as well.
Yeah, absolutely. Hospitals and healthcare organizations want a quick fix. And I don't think it's fair to just say hospitals and healthcare organizations. Most organizations do want a quick fix to improve SEO. It doesn't really work that way. Even if you implement the tips we just ran through there, you'll still need to monitor progress and go back to make changes if something isn't working. Here's a neat table here, the periodic table of SEO success factors. There's a lot at play here, as you can see. It's not just write your titles, meta descriptions, and then away you go.
And the guys who are responsible for this infographic, they update it every time Google updates its algorithm. So that re-emphasizes the point that SEO isn't a one-time and done thing. Google's always updating its algorithm. That means SEO guys have to be on their toes when it comes to ensuring all of these things are implemented correctly.
That's a lot.
That is a lot. There is a lot to it. Yeah.
Some of them can get you into trouble.
I used to say 15. There's 15 different things that incorporate into having good SEO, but it looks like it's a lot more than that.
It is now.
Yeah.
It certainly is. But I do think, though, you got to at least get the basics down. You've got to get those titles and descriptions, and you've got to be giving useful and relevant content. And your site's got to load. And then after that, this is it's a complicated mix, but.
Yeah, and this illustrates perfectly. It's not just about content. This is also about the way your website's built from an architectural point of view. So it translates into a lot more than simply keywords and content.
If you haven't already at your organization, it's critical that you introduce search engine marketing, SEM, or PPC, Google AdWords, pay-per-click campaigns. 81% of people click on a sponsored link when looking for health information online. Health-related searches in Google are up 47% from 2012, and 80% of internet users looking for health information online. Investments in SEM are usually smart ones. You pay for clicks on the frequency, precision of your ad. It's based on how relevant Google thinks it's mapped to the keywords you're targeting. We have experience in enhancing an SEM campaign. We don't have to get into the specifics here for time here, Chad, but I think, like SEO, I think we found from this that it's important to consider it as a process. And how thoughts on that?
Yeah, definitely. I think what we found here when we took over the Jimmy Fund campaign, SEM campaign, it was for the walk and run. It was about getting about getting people to sign up for the walk and run, which was a $350 minimum buy-in. Right?
Sure.
So the minute somebody signed up, that was $350 because that's what they had to raise. But what we found when we started doing the research on it and habits was that certain people coming from certain places and looking at things in certain ways, having certain behaviors, had such a low probability of actually converting to sign up to go to the race, that what we did was we started to filter those people out over time, which really drove down the amount of spend that the Jimmy Fund was paying per click. And we also then looked at the flip side of that, who was converting and how do we get more of those people. And I think another example, one that we're doing right now and have been for a while, is a bariatric campaign, a surgical weight loss campaign. In that, we started out with 2.5 years ago with a $3,000 a month spend to put people in informational sessions, which is a first step in the process of going through that procedure. And I think the latest report that we did is that we're spending about $2,100 over a 4-month period with the same, if not better, results, which we're filling the seats on those informational sessions. So
yeah, click-through and conversion rates on that campaign are 4 times the industry averages that studies out there will show. So
Yeah.
a lot of great work's gone into that to provide some great results.
yeah, but we got a good partner there that kind of stuck with it. But we were able to show the return on investment even at an early stage, even when we were spending $3,000, so that the marketing director could go to the CEO and say, "Hey, here's the return on investment we had on this $3,000 spend, and a few $1,000 upfront cost for SilverTech," and then we equate that to what the return is for somebody actually becoming a patient, which is substantial for that particular procedure.
Excellent. We'll get the full Jimmy Fund case study out as one of the resources after the presentation here. I think, though, if you're having a difficult time securing a budget to experiment with search engine marketing, you can consider a campaign specifically, say, for your physicians using their names in the content. So for a fraction of what an average marketing department spends on a Yellow Pages ad or something a traditional marketing department might do, you can craft a campaign with a larger reach that appears specifically for those looking for your services. So SEO, SEM, it's all about validating. It's all about reputation and just making sure you're where your patients are looking for you. I think we have a few minutes now to get into our last section here, targeting patient personas. This is an example from the Catholic Medical Center here, a local example and someone we've done a lot of work for. Different areas of their website are designed with specific audiences in mind. For example, Mom's Place is meant to be attractive to expecting mothers, while the bariatric service is meant to be compelling for both men and women who are overweight. What is a persona? A persona is a fictional character that represents your typical website visitor. Personas help you identify needs, motivations, pain points, expectations, and goals. And personas put a human face to your abstract customer data. Why do I need personas? Pete, thoughts on why you need personas?
Well, it's just the only way, really, of understanding who your target audience is and what their requirements are. And unless you know that, you don't know what the purpose of your website or any of your other digital assets is. You're marketing to individuals. You got to know who they are. If you don't know who they are, how does that translate to your own business goals? In understanding who your personas are, you can tailor what their needs are to your own business goals and really make sure that your initiatives are driven around that. So they're really important.
Critical. Yeah, I think they're critical to creating a good user experience. And a good user experience is as we talked, that website user experience is part of the patient experience.
Yep.
And personas too, they prevent that self-referential bias design, or if you're writing content, it's almost impossible to not write it as you think you would want to see it. But you as a marketer are not necessarily the patient who's looking for your content.
We've run up against this with a couple of healthcare providers that we're working with that have told us up front, you're going to be going up against some very strong opinions internally about what content should be on the homepage. And the main message we try and put across every single time is it's not really about egos or internal opinions. It's about what your prospective patients and existing patients need. What do they want to see?
Mm-hmm.
Yeah, I think we have an understanding in hospitals of the internal personas and a lot of times the politics.
Yeah.
When we're navigating relationships and working in organizations and helping marketing departments, because it's definitely something we look at. But the persona is really, we might find over time that we might have an initial persona, say for a surgical weight loss. And then we find over time through research and optimization, that, hey, we've created this sales funnel. We know that, for example, they need 3 touch points. One is going to be to watch a video, one is going to be to fill out a form, one is going to be to read certain information. So we can start to really narrow down what those people want based the persona as a starting point, but then really validating that over time.
And personas don't ever have to be done, right, Pete? I mean, this is not, we shouldn't just, we're writing up copy for a new website, create our personas, write it, and then just set it and forget it.
Right. I mean, technology is constantly changing, which means patient demands are changing too, and the kinds of experiences that they demand off the back of the available technology to them are going to be changing. So that means that your persona should constantly evolve because people's requirements are constantly evolving as well. So it's a good opportunity to develop personas and benchmark, and then use your data going forwards to refine those personas. Use marketing automation campaigns to collect further information and fill out those personas and ensure that they evolve as user requirements and industry innovations evolve too.
Mm-hmm. A few numbers here to back up our belief here in using personas for kind of everything content related. A persona-based website can see a 200% increase in website traffic, 97% increase in website generated leads, and 124% increase in website generated sales. We do have, and I know that one of the resources that we will share with our presentation here is a template how to create personas, just to get you started, just the questions that you need to ask, understand the demographics of who's coming to your website. So just a way to kind of get you up and running there. Drawing us to a conclusion here of our presentation, we hope you can come away with some good takeaways. I think what we wanted to get across is that it's time to embrace this paradigm shift of digital transformation, and I think throughout your entire organization, not just at the marketing department. Use your website as the hub to own and manage your physician ratings, and then on that website, organize and optimize your content for how your patients are searching, and then use your personas to get to know your audience and then be able to really refine and guide the patient on the journey. Anything else you'd like to add, Chad, Pete?
Yeah, I'd like to add something to the first point, embracing the paradigm shift. I mean, this isn't something that I don't feel is optional for any healthcare provider.
No.
I mean, the standard has been set at the national level, and there are frameworks in place that are driving this paradigm shift. It's not something that you can choose to do or not. Those that are going to actually embrace these initiatives are going to be the ones that succeed and get the most out of business acquisition and acquiring new patients.
Thank you so much. Again, I'm Ian Hughes, content marketing strategist here at Silvertech. I was joined by digital strategist Peter Palmer. Thank you, Pete.
Thank you.
And I was joined by our senior account manager, Chad Campbell. Thank you, Pete.
Fancy title, yes.
Yes, thank you, Chad. Again, we will follow up with the presentation and several other resources. Thank you so much for joining our presentation today.